Good evening and welcome to the virtual Connolly branch of the Boston Public Library. My name is Emily Todd and I'm one of the librarians at the branch, and I want to thank you all for joining us tonight. Before I introduce our guest speaker, I just have a couple of housekeeping items. So first, I want to mention that the chat is open during this webinar. Following the presentation, there will be an audience Q&A, and if you have a question, I want to invite you to type it into the chat or submit it via the Q&A button. In the interest of getting this information to as many people as possible, the webinar is being recorded and will be shared eventually on the BPL's YouTube page. So now I'd like to introduce our speaker tonight, Claire Lobdell. Claire is a member of the Library Freedom Project, a surveillance, resistance, and digital privacy organization. She is also the distance education librarian and archivist at Greenfield Community College in Greenfield, Mass. Welcome, Claire, and thank you so much for joining us this evening.
Thank you, Emily. Should we get started, or do you think we should give people just a couple more minutes to trickle in?
I think you can go ahead and get started. That's all right.
All right. Well, thank you very much for that introduction. So the way this presentation is set up is that the first half of it, I'm going to be giving some real examples of the ways that personal data about one's pregnancy status can and have been monitored by companies and private entities, and also used against people by law enforcement. And then in the second, and that can be scary and feel really dystopian. I don't want to leave you in that scary place. So the second half of the presentation is really going to be about the ways that you can protect yourself from those surveillance capabilities. Like Emily said, the chat is open, so if you have questions, you can put them in the chat. There's also a Q&A section where if you have a question but you don't want it attached to your name for whatever reason, you can put that in the Q&A, and then only I and Emily will be able to see that. So it's been just a few days, over a month, since the Supreme Court released their decision in Dobbs versus Jackson Women's Health, which overturned Roe versus Wade. I think we knew it was coming for a while, but it still felt like a big shock. Here in Massachusetts, this is the BPL hosting it, there might be people joining us from elsewhere, but here in Massachusetts, we are somewhat lucky in that a year or so ago, our legislators passed what they called the Roe Act, which enshrines the right to abortion access in state law. But as Massachusetts residents, these laws still affect us. Abortion bans around the country still affect us. We have loved ones in other places. We travel for work or for school. We are also threatened by them because there are people running for Congress who who, if they take control of Congress, want to pass a nationwide ban on abortion. So one thing I'd like people to think about as we are in this presentation is the idea that individual safety, so safety for individuals, requires collective action, and that our choices and actions in digital and physical spaces directly impact the safety of others. I'll give some examples of that as we go along. This is a current map, or current as of, I think 3 or 4 days ago, of the state of abortion access in the country. Sorry. As I said, Massachusetts has the Roe Act. This map was put together by the Guttmacher Institute, which is a think tank that tracks reproductive rights information in the US, but also around the world. And so they've put together this map that it's constantly in flux because, in the wake of the Dobbs versus Jackson Women's Health decision, lots of states are quickly updating their laws. Oh, you're not seeing the map. Okay. Let's see. Sorry. You know what? I didn't start sharing yet. All right. Sorry about that.
Not to worry, take a moment.
Yeah, okay. Can people see that now?
I can see it. Yep.
All right, great, awesome. Yeah, sorry about that. So, yeah, this is the current status of abortion access around the country. The Guttmacher Institute made this as sort of a gradient where, the maroon states are the most restrictive up to like Oregon, and the dark blue is the least restrictive. You'll see that actually Massachusetts is in the sort of right in the middle. And I think that's because we still do have there's a parental notification and parental consent law that requires parents of minors, I think under 16 or 16 and under, to sign off on abortions. And also abortions are banned here after 24 weeks. But as I said, this is constantly in flux because state legislators are constantly trying to update their laws. Earlier this year in Louisiana, there was a bill proposed that would have granted fetal personhood from the moment of fertilization and would allow a person who has an abortion to be prosecuted for murder. That wasn't passed in this past session. People in legislators in Arkansas and South Dakota have publicly spoken about restricting pregnant people from traveling out of state for an abortion. Some interpretations of Texas's SB 8 already, some people interpret it to open folks out of state to civil litigation for assisting with abortions for Texas residents. So your own personal risk as far as this stuff goes is going to depend on who you are and where you are. Just as another example, South Carolina legislators have proposed a bill that would outlaw websites that tell people how to get an abortion. So those websites, access to those websites would be banned for internet users in South Carolina. And it's based off a template by the National Right to Life Committee. So, this legislation is likely to be proposed in other states. It would outlaw providing information over the internet or phone about how to obtain an abortion. It would also make it illegal to host a website or provide an internet service with information that is reasonably likely to be used for an abortion. It's important to note that, I'm going to show you some examples of ways that people have already been prosecuted, been harmed by data about their pregnancy status. These are all pre the overturn of Roe. What I was going to say is it's important to note that these sort of abortion bans, while the people most directly put at risk by them are folks who are seeking safe and legal abortions, really they endanger anyone who has the audacity to move through the world and with a uterus. Just as an example, so in 2019, a woman named Marche Jones got in a fight and was shot in the abdomen by another woman. Marche was pregnant, the fetus died in the shooting, and Marche was actually the one who was arrested. She was charged, I forget if it was with murder or manslaughter, but they said she recklessly caused, the death of the fetus she was pregnant with. The example on the right is a headline, "Take a Valium, lose your kid, go to jail." This was an investigative report by ProPublica that was showing the ways that in certain states, including Alabama, people had been, had faced drastic punishments for very minor exposure to controlled substances in the womb. So this one woman was charged with knowingly, recklessly, or intentionally causing her baby to be exposed to controlled substances in the womb when she had a single Valium to help her go to sleep a few weeks before she gave birth. She lost custody of her child, lost her job. So, people's actions, even pre-Dobbs, have really been curtailed by laws like this. It's also important to note that it can be very difficult for doctors to distinguish between abortions and miscarriages. People here and elsewhere have been prosecuted for miscarriages. This is a place where, when a pregnant person comes into an emergency department with heavy bleeding, hospital staff biases come into play. Is the person poor, a minority, young, a sex worker? In all those cases, people who are more likely from our society to be scrutinized anyways are going to bear the largest brunt of suspicion. Between 1973 and 2020, this organization, the National Advocates of Pregnant Women, a pro-choice advocacy group, recorded 1,600 arrests against pregnant people, with about 1,200 of those in the past 15 years for things like falling down, giving birth at home. The majority of those included drug use, and women of color were far overrepresented in that. So our purchases, the apps we use on our phones, our location data, and other things that we do online leave digital traces that data brokers, advertisers, and companies compile about us into detailed profiles. And the most common way that people are going to, the most common places that we leave data about our choices are in those apps and interactions we use most often. So things like email, text, browser history, things like Facebook Messenger, Facebook groups. These are the most common places that say, like in SB 8, the law in Texas that pretty much puts a bounty on people who help others obtain an abortion. Those are the most common places that someone would look for that information. Even before, the current overthrow of Roe, there have been cases where texts and web searches about abortion have been used to prosecute women for ending their pregnancies. This article that this headline is from says that in practice, police and prosecutors have used the most easily accessible data gleaned from text messages and search history on phones and computers. They're sometimes turned over voluntarily or obtained with a warrant, and these are a gold mine for law enforcement. One thing that's gotten a lot of press, I think, just recently, in the past few weeks, at least I've seen a lot of people talking about this on Twitter, is concern over the way that information from period tracking apps might be used. There was some reporting on this that came out a few years ago. So 2018, a couple different investigative reports showed the ways that these apps were sharing information with Facebook and others and monetizing the personal data that's put in there. So the way that they did that is Facebook offers app developers something for free called Facebook Developer Kit. It's like a platform or it's software that basically that has like the basics of an app in it. They give it for free, but the thing that Facebook gets out of this is that they get a lot of the data from how people use the apps that the developers then create. In at least one case that these articles were talking about, that data was actually shared in plain text, so not like scrambled at all, just in human readable text over the internet. This wasn't just about when people had their period, but included things that people might include in a period tracking app, like when they had sex, you know, when they were ovulating. People who were using the app had no idea that that data would be shared to Facebook. And I think, you know, probably a lot of people would not be very comfortable with Facebook knowing when you have sex. If this information is used for one purpose, like marketing, it can also be used for another purpose, such as law enforcement. Just to stay on the theme of Facebook for a little bit. Facebook collects a huge amount of data about its users, which I think a lot of us realize. It licensed that information to advertisers. And this is not just the information that you share when you make a post or, you know, like something. It's also, it is information that they glean from the other apps that you look at, the other searches that you do outside of Facebook, but while you are logged into Facebook or, you know, have a Facebook cookie on your computer. This is a screenshot of an ad campaign that the privacy-focused messenger, encrypted messenger Signal tried to run on Facebook. And it really highlights the granular information that Facebook collects and shares with advertisers so that advertisers can micro-target who sees these ads. Facebook claimed that this was a stunt and a hoax. Signal claims they tried to run the ads and Facebook rejected them. But anyways, so just, you know, the first one says, you got this ad because you're a K-pop loving chemical engineer. This ad used your location to see you're in Berlin and you have a new baby and just moved and you're really feeling those pregnancy exercises lately. You know, that is information, the bits that are highlighted in dark blue are the types of information that an advertiser could use to micro-target their ads. So credit cards and customer loyalty accounts also are used extensively to track a person and have been used to figure out who is pregnant. This is in 2012, so a decade ago now, the New York Times did a story about how Target, the company Target, used customers' credit card data to predict who might be pregnant because baby registries are extremely lucrative, and they had discovered that people who create baby registries at Target tend to be from then on really loyal Target customers. And so they wanted to target that market using predictive analyses. So these quotes are really long, but I want to read them aloud because I think they are really helpful in understanding how companies can use credit card data. So this is direct quotes from this article. Target assigns each shopper a unique code known internally as the guest ID that keeps tabs on everything they buy. If you use a credit card or a coupon or fill out a survey or mail in a refund or call the customer helpline or open an email we've sent you or visit our website, we'll record it and link it to your guest ID, Pohl said. Pohl was the person who developed the system. We want to know everything we can. Also linked to your guest ID is demographic information like your age, whether you are married and have kids, what part of town you live in, how long it takes you to drive to the store, your estimated salary, whether you've moved recently, what credit cards you carry in your wallet, and what websites you visit. As Pohl's computers crawled through the data, he was able to identify about 25 products that, when analyzed together, allowed him to assign each shopper a pregnancy prediction score. More important, he could also estimate her due date to within a small window so that Target could send coupons timed to very specific stages of her pregnancy. And these were not necessarily, these 25 products were not necessarily things that like you would probably ever associate with pregnancy. one of them that I remember was like unscented lotion. You know, I guess because they thought like, well, since you know, if you have morning sickness, a scent might make you throw up. But you know, this again was a decade ago. So if you know, consider how much technology has advanced in the past decade, these sorts of capabilities are you know, that much more now. I mentioned customer loyalty cards. These are things like a CVS card or a Walgreens card. This is a post I saw on Twitter just a few days ago. So, you know, purchase data from customer loyalty cards is shared with outside companies. A lot of times, even though it says like CVS card or Walgreens card, it's actually processed by a third-party data broker. So this Twitter user said, the post reads, "Dear Walgreens, I received this package today, a week after purchasing a pregnancy test at your store. I was asked to take the test by my doctor despite having no fallopian tubes." So the picture is a box of baby formula. Later in the Twitter thread, they say they used their customer loyalty card to buy the pregnancy test, and this showed up a week later in the mail. They were particularly incensed, number one, that like, you know, this information was being shared. Number two, they couldn't see any other place where Enfamil would have gotten their contact information from. Number three, there's this like baby formula shortage around the country. So why are they just sending this to random people who may or may not be pregnant? And number four, this could really endanger people, you know, especially someone who's living in an abusive relationship who, you know, if they are pregnant or are worried that they could be pregnant, you know, their abusive partner might use that against them, or that could put them in further danger. There is a technique called Geo Fencing that both advertisers use and law enforcement uses. It uses the location data from cell phones and sort of puts a fence around a particular area and says, okay, like we're going to track anyone who goes in or out of this area, or you know, whose phone shows up in this area. Back in 2016, a Boston-based advertiser came up with the idea of targeting people who were in abortion clinics and also some other places, I think like methadone clinics, and then sold that information to anti-choice groups so that the people who were in these waiting rooms, if they, you know, had their location data turned on, they would be sent messages by some of the companies that he worked with were crisis pregnancy centers and evangelical adoption agencies. So they would ping the women with, or the people in those waiting rooms with advertisements from those places. Also, geofencing is used by police in various situations. There are a lot of other apps, including dating apps and weather apps, that collect and sell location data to third parties. There was something that came out in, I think, 2019 about how the US military was buying location data from various apps, including a Muslim dating app. You know, that app used location data so that people could find other singles in their area, and users had no idea that it was being shared or sold to third parties, especially not the US military. Another place that sensitive information can be compromised is smart speakers. You know, so many houses have smart speakers. I'm a librarian. Some libraries have smart speakers at the desk or that they loan out. This Bloomberg reporting team did a series of reports. They found that Amazon workers were listening to what people tell Alexa. They were listening to clips to see if Alexa correctly identified what the people were searching for or looking for, when they asked Alexa for something. But then a week later, they also reported that Amazon workers were able to access those Alexa owners' home addresses. So I think it's, you can envision a situation in which there's a disgruntled or vigilante employee of Amazon or whichever smart speaker company it is who, wants to find out who is looking for information about abortion, or who even is having conversations in their house, not, talking to Alexa directly, but who is having conversations in their house about it. Police can and do issue warrants for smart speaker records. Those subpoenas are increasing. This headline says, "Meet the star witness, your smart speaker requests are rising from law enforcement for information on the devices." These include internet queries, food orders, and overheard conversations. This is also an instance where that bit about how we are responsible for each other's safety really comes into play. It's not only your own personal safety, you're only your own ability to make choices for yourself that could be compromised by what you say in a room with a smart speaker. It could also be whoever you're talking to or about. Sorry, this is, don't know why this is there. Yeah, so I think, in the last 10, 15 years, at-home DNA services like 23andMe or Ancestry.com have become really popular. These databases, both in law enforcement and consumer databases, which often work with law enforcement, can identify you through your relatives. This is called forensic genealogy. This article, which was published in October 2018, said that approximately 60% of white Americans could be ID'd by the DNA data that was already in consumer databases, and they estimated that proportion was going to go up to 90% within 2 or 3 years. So, we're already there. And, the number of Black and brown people who could be ID'd by their DNA has also gone up during that time as well. I think the prevalence of that forensic DNA, it really came to, I think it really came to public, the public's awareness. I think it was in 2018 when it was used, forensic genealogists used, commercial DNA databases to catch the Golden State Killer, a serial killer. And it's hard to feel bad about that, but that technology that can be used in one way can be used in another way, which, is to potentially identify the parents of fetal remains. And in at least one case that has been done, not necessarily using a commercial DNA database, but in 2018, Georgia law enforcement tried to, or, attempted to test the DNA of fetal remains found in wastewater. They did an autopsy and the fetus had never breathed air, which means that it wasn't, this wasn't an infant that was born alive and suffocated or something. It was miscarried or aborted. The caption under that picture reads, "Neither the fetus nor the 2 people with whom its DNA might match have committed a crime." So, if this technology has been used once in this way, I think it's almost certain that it will be used again. And so, I don't want to shame people for their use of tests like 23andMe. I know some adopted folks and children of adopted folks who have found, personally, I know folks who have found their relatives, and that's been incredibly meaningful for them. At the same time, I think we need to be aware of the way that our choices could affect the choices of relatives who we may not have even met before. Just wanted to say something quickly about schools and school-owned devices. So even before COVID, a lot of school districts provided laptops or Chromebooks to students. And then, during COVID and school lockdowns and remote school, there was a huge increase in that. Districts got grant money from the government to do that, to provide access to remote learning for every student. The way that those school-owned devices are configured really limits the ways in which they can be used. I know in my own kids' school district that so they use Chromebooks, and the way that Google Suite for Education or Google Apps for Education is set up in the district, any way that a student interacts with Google while signed into their student account is saved from when they started. So potentially from kindergarten to when they graduate. That includes any searches that they do, any documents that they create and think that they've trashed, any way that they interact with the device that is saved for the entirety of their education. Also, private browsing is disabled, so there's no way to browse privately. At least a few years ago, my school district also contracted with this company called Goguardian, which had a few different things, but one of the things that they offered was the ability to create a list of trigger words that if a student used those in a search or in their writing or email, that would notify administrators. And, it was marketed as a way to prevent suicide and potentially prevent violence. But because it's up to school administrators to decide what words are on that list, it's very easy to envision a situation in which an administrator, puts abortion pills on that list, or abortion or ending a pregnancy as like a trigger word or trigger phrase, and gets a notification when a student uses those words. So now we're going to move into the portion where we talk about how to figure out, based on who you are, where you are, what your own personal risks are. So you can call this a risk profile. It's also called threat modeling. This is an idea that comes from the information security field, and it's a way of thinking about the security needs of different systems, different users. And it's a really helpful way of conceptualizing the needs of different people. And it's a series of 5 questions. So the first is, what do I have that I want to protect, or what are my assets? The second is, who do I want to protect it from? In other words, who are my adversaries? How likely is it that I will need to protect it? How bad are the consequences if I fail? How much trouble am I willing to go through to try to prevent potential consequences? And so I'm going to go through and give examples of what those might mean. So what are your assets? These could be things like communication, so emails or texts or the Facebook messengers, contacts, people you get in contact with. Also, if you are living in a place with limited abortion access or where abortion is fully illegal, these could be the people that are helping you. This can be your location data, social media accounts. It can also include things like your physical safety and the freedom to make your own medical decisions. Those are definitely assets. So who are your adversaries? This is one that really depends on, this is very specific to who you are and where you are, but it could include things like law enforcement, so police or prosecutors, data brokers, any company that tracks and stores information about you. It can also include, family members or intimate partners or roommates, people who want to use pregnancy as a way to trap someone in an abusive relationship, or who, upon finding out that someone is pregnant, might be furious. In the case of SB 8, that Texas law, and ones like it in other states, these your adversaries could be people who will sue those who help you obtain an abortion. Really, or if you have a family member who, might know your information and not be trustworthy. So how likely are you to need to protect these things? It's going to depend on the laws in your local area, whether you can trust those people around you, and to some extent, how wealthy you are. Do you own your own devices, or do you have to share them with other people? Are you able to afford your own internet connection, or do you have to rely on public Wi-Fi? Are you able to travel to another place? How bad are the consequences if you fail? These can include things like being trapped in an abusive relationship. You can risk your physical health, arrest or incarceration for you and those who help you. You could lose custody of children. We know that the average person who is obtaining an abortion is already a parent, already parenting children. So I'm going to go through some of the ways that you can prevent these consequences. I'm going to say you when I'm talking about this, but these are going to depend on, again, who you are, your own personal risk profile, or your own personal threat model. I'm going to first talk about some of these low-tech steps that you can take to prevent those potential consequences, and then I'm going to talk about some higher tech ones. So the first one is to keep a narrow circle of trust. Can you trust the people you live with? Can you trust your family? Oops. Sorry. The second one is to pay cash for anything pregnancy related. This gets back to the bit about how credit card information is used to create a detailed profile of who you are and what you do. Also, don't use a customer loyalty card when purchasing things pregnancy related. Turn off location tracking, and don't bring a phone to a clinic, or or a place where you are, say, meeting someone who is getting you medication for medication abortion. We talked about Geo Fencing. There's also something that law enforcement officers use called a Stingray, where they it basically like spoofs a cell phone tower. You're in a particular location, you think that you have, it looks to you like you have cell access, that you have, access, but texts that you send or outgoing calls are caught by this Stingray. The calls don't actually connect, but the texts maybe look like they've been sent, but it's really law enforcement who's receiving them, not the person you're sending them to. If you are able, park away from locations and walk. Many modern cars have built-in GPS, and even long before this, there is a long history of anti-abortion activists photographing the license plates of people at abortion clinics and harassing them using that information. Also, many police cars have automated license plate readers, cameras that identify license plates. So, you know, if you can park away from clinics or meetings and walk to them. And then, you know, don't talk about anything sensitive in a room with a smart speaker. So then as far as some higher tech steps, these would include things like using the Tor browser or a high quality VPN virtual private network when searching for an abortion. And I'll talk a little more in a minute about what those are. This is going to be especially the case, like if that, what is it? This South Carolina, if that South Carolina law passes that would prevent you from accessing websites that share information about abortion. Don't reuse passwords or link accounts. So linking accounts is like, you know, a lot of services you'll see sign in with your Google account or sign in with your Facebook account or your Amazon account so that you're only using one single sign-on for multiple things. You know, if your password for that one account that you use to sign in for everything gets compromised, all of those are compromised. And then also enable two-factor authentication anywhere you can. Two-factor authentication is when you need a second piece of data in order to log into something. So it's, you know, one of those things where you put in your password and then a 6-digit code or something is texted to you and you have to enter that as well, so that even if your password gets compromised, hopefully whoever has your password doesn't also have your cell phone so that they're not actually able to get into your account. You can use encrypted texting, a service like Signal, which I will explain more in a minute, within expiring messages to discuss anything sensitive. And then if you can, turn off biometric authentication on your phone. These are things like fingerprint or face print, and instead use a password. It's really easy for someone to hold up your phone in front of your face and, have it unlock, or for, someone, say when you're sleeping, if it's a partner, to put your phone under your finger in the middle of the night and unlock your phone. All right, so the Tor browser that I mentioned, it stands for the Onion Router. It's a browser that doesn't save information on your local device, but it also makes it so your ISP, your internet service provider, like Verizon or Comcast or whatever, doesn't know what websites you're looking at. And it doesn't know who you are unless you, and the websites you're going to don't know who you are unless you sign into them or otherwise enter information. The way that it does this is that it bounces the path of your internet signal through various computers that strip away identifying information from you. There are also versions of Tor for Android and for iPhone as well. I would recommend that you go to torproject.org to download Tor, just because there are fake ones out there. You can get Tor for Macs, Androids, PCs there. If you want to get it for an iPhone, you would have to get that through the Apple Store. The one that is most legit is called Onion Browser. It's almost Tor because of some of the required Apple software. It doesn't have quite the same level of protection, but it's still pretty good. I also mentioned VPNs, virtual private networks. So they do a similar thing to Tor, although there is a wide variety of VPNs out there. The idea is that it masks who you are and where you are going on the internet from various outside entities. But there are, as I said, a wide variety of VPNs, and some of them keep a log of where you're going, even if the end website doesn't know who you are. The information about what you visited might still be saved on your local device, as it isn't with Tor. And the free ones can be somewhat vulnerable. So I would recommend going to the Digital Defense Fund, which is an organization that does information security for the reproductive rights movement. They have a really good guide to choosing a VPN. I would also recommend that everyone look up their email address in this website, haveibeenpwned.com. You put in your email address and it checks to see whether your credentials have been included in any data breaches, any large scale data breaches. This is my work email address, which, at the time I did the screenshot hadn't been in any data breaches, but my personal one was included in lots of them. If you find that your password, your credentials have been compromised, you should change it for that site. And this is another reason why you shouldn't use the same, email password combo, the same credential combo on every site. Strong passwords are long, random, and unique, but it's really hard for our brains to remember long strands of random, unique characters. One thing that we are good at is remembering words. So a long, strong password can just be a series of unrelated words, not something like song lyrics or, parts of a poem where if you know a few of the words, you could predict what the next ones are going to be, but something like flip phone, migrate, itchy, pachyderm noodle. It's something silly that you're going to remember. There's also a way to create them called diceware, where you roll a dice and then based on what the dice says, you choose that word that corresponds to it off a long word list. And so the way that I use this is that I have a really strong password that I use as my master password for a password manager. And then that password manager creates and stores other randomly generated passwords and fills them in for me when I use different websites. I also mentioned Signal Encrypted Messenger. This sends your messages scrambled through the internet. You can also set up disappearing messages for your individual contacts. You could say, I want these to disappear on, the other person's device as soon as they're read or after an hour. You get to set the time. It also, if you're using an encrypted messenger, even if there is one of those stingrays, say, set up, hopefully the stingray would only get the garbled message. They wouldn't be able to see what is actually being said. There are many organizations out there that are committed to helping people still get access to reproductive care and abortions in places where it has become illegal. So these include things like the abortion travel funds, Plan C, Pills, the Digital Defense Fund. Those are the people that made that, the guide to VPNs, and an organization called Aid Access that helps connect people to medication abortions through the mail. So thank you to all these people for making this possible. The Connolly and Jamaica Plain branches of the BPL, Library Freedom Project, National Forum on the Prevention of Cybersexual Abuse. Because I'm a librarian, I included my references. So I think at this point, I will stop and go to questions if anybody has any.
So Claire, we got a question in the chat. Catherine asked, do you have any examples of what kind of language would be a red flag or pose a risk of sharing info regarding pregnancy status in an app or website's privacy policy?
I think, well, so privacy policies are notoriously complex and full of legalese. They're usually deliberately obscure. I think what you really should be looking at is how it says your information can be used. Do they share it with other partners? Do they, like third-party partners? Do they, is there a way for you to opt out of various uses of information? I mentioned the thing with like pregnancy or period tracking apps being built on that Facebook developer kit. I don't know that there's a way to find out like whether your app is built using that, other than like actually contacting the company themselves, like the app developers, and saying, hey, can you tell me if this is built on Facebook's platform? For any app, you can go through on your phone settings and say like, okay, I want to turn off location sharing for this. There are ways that like on your own end, you can, set what permissions it has, but yeah, I don't have a great answer for that. That's a good question though.
If somebody knows who's on the webinar, please feel free to drop that info in the chat if you want to expand on what Claire has shared. We have a question from Danielle asking, so on the low-tech options, not talking in a room with a smart speaker could be a challenge with tablets and computers that doctors use, which incorporate that tech. Do you have any ideas on a workaround?
That doctors use? Yeah, that's a tough one. I know like I've turned off, say like, hey Siri on my phone. There are some of those where like, there are ways like on a phone that you can set it so it's not always listening. As far as doctors go and medical devices, I mean, I think that's a case where you really need to look and see, if you're working in a healthcare situation, really look at your policies. I mean, it's also a time when maybe you have those conversations like before you're actually in a room with a patient who is seeking reproductive care. Like that's probably a conversation that medical staff should have among themselves if they're worried about how things could be used. Like, okay, should we make a policy that like, if we're in a state where we're worried about how this information could be used, are we gonna write down some of this information rather than say it aloud? Or can we turn off some of that voice activated, some of those voice activated features? But that's a really good question too.
And then in the chat, Kelly is asking, what advice would you have for other librarians who are interested in hosting programs or information sessions on this topic, but are in states that are hostile to reproductive rights?
Yeah, that's a really good question. I think it was, I want to say it's Oklahoma that, or librarians in Oklahoma were just told like not to use the word abortion when they are talking to patrons, and not to help patrons find information that could be reasonably expected to help someone get an abortion. I know that ALA, Office of Intellectual Freedom, is working on this. Also, the Library Freedom Project that I am involved with, we're working on putting together some resources that are going to be kind of like that Guttmacher map, where they're like color coded based on, you know, the laws or risks in your own state. So that is coming. The other thing that I could say is, like, there's a lot of overlap between the threat model of someone who is seeking an abortion and the threat model of someone who is in an abusive relationship. And so if you want to share information about how to protect the digital privacy of someone who's in an abusive relationship, that would probably be pretty applicable as well to someone who is seeking reproductive care in a place where that is not legal.
Yeah, and if I could add to what you said, Claire, I think a lot of it too is just knowing your community, because you may even be in New England and it may be that the community is not it may be oppose or disagree with it, and or you may have a very vocal local community members who don't want, you know, to see those programs. That's where knowing your community can come in as well.
Yeah, that's a good point.
Okay, so we got another question. Someone's asking, I'm curious how secure or Signal really is. If the assumption we've been making is that voice messages are more secure than written messages, are there workarounds or better options in how it might have happened? And I think this person also shared that, I guess they and a friend were at the airport and got stopped by Homeland Security, and Homeland Security was able to access their written messages on Signal, but not the voice messages.
Yeah, so that would, I mean, you could still set up the disappearing messages. So I know, like, on my phone, there are folks that I have disappearing messages set up with and folks that I don't. Signal, yeah, you can send texts, you can also make phone calls with it. The encryption is really most effective at the, like, point of transit, right? Like when it's being sent, the encryption is like when it's being sent from one device to the other. At the point at which your device has already been unlocked, it's like less secure, but basically anything on your phone is a lot less secure at the point at which your device has become unlocked. I'm trying to remember whether you can, like, I'm trying to see, there might be a way that in your settings you could require a secondary password on Signal, so that you can't, so that you, like, even if your phone is unlocked, you still need to enter another password in order to unlock Signal, but I'm not 100% sure on that.
Okay, and we just got a clarification. Someone saying you can also set Signal messages to delete automatically and very quickly. And the person who had asked the question originally and shared their experience about Homeland Security said it was worse than that. It was not the airport randomly, it was targeted, and it was disappearing Signal messages that were printed out and recovered.
Wow, that's really, wow. Sorry, I'm just reading that. That's intense.
My cat's coming through to say hi.
Yeah. I would say that goes beyond my level of expertise. I'm really, yeah. I wonder if there's been reporting on that. That's the type of thing that, like, if there hasn't already been reporting on it, I would encourage that person to potentially talk to a reporter. Sometimes, you know, a reporter can get more information than a member of the public can, but also it sounds like something that potentially there should be reporting on. There's, let's see, some folks at Motherboard, the Intercept might be interested in that.
Does anybody else have any more questions? It looks like we've come to the end and we're at 8 o'clock now. So,
Yeah.
Well, I guess we can leave it there if nobody has any other questions. I do want to just share again, we did record this. It will be posted to the BPL's YouTube page, and if you registered for this webinar, we will be sharing the link to that, as well as links to what Claire has shared tonight. And I just want to thank you, Claire, so very much for coming out and presenting and sharing this incredibly important information to us this evening, and thank Amanda from BPL-AV for helping us with the technology this evening, and to folks at the Jamaica Plain branch for helping co-host. And also thanks to the Library Freedom Project for all the great work they're doing in the library field.
Thank you. Thank you so much for hosting.
All right. Have a good night, everybody. Stay safe.